Company Aspen Pharmacare says its sterile manufacturing plant in Gqeberha is ready to respond to a monkeypox outbreak, which has been declared a public health emergency by the World Health Organization. We're joined now by Dr Lisa Bonadona, the Aspen Group Executive for Biologicals and Commercial. Dr Bonadona, good evening to you and thank you for your time. We don't know yet if we'll have to provide vaccines and treatments for monkeypox. What kind of facilities do you have available?
So, building upon the COVID-19 pandemic and the investments that Aspen Pharmacare had made, we actually have the capacity to fill and finish vaccines. And in fact, we continue to do so for our partner J&J with their vaccine, and have the capacity and the willingness to also supply our own vaccine, Aspen. So as you can see, very well-established facilities already exist, which we can adapt to respond to any need for monkeypox vaccine.
As I understand it, the monkeypox virus is related to the smallpox virus. It actually depends on how old you are in South Africa as to whether you were vaccinated against smallpox or not. Is the vaccine quite similar? Does that make it easier?
So there are two currently available vaccines, and they are very closely related to the smallpox vaccine. In fact, one of the vaccines is licensed in the US by the Food and Drug Administration Authority, and also very recently this week, by the European Medicines Agency. The other is also approved by the FDA, and both have their origins in smallpox vaccine.
So I presume that would make it easier to then produce these vaccines on a large basis. I mean, there would be one for monkeypox and be able to do it quite quickly.
Quite quickly, and also because they are very similar and from a similar origin, we have a lot of technical understanding in terms of manufacturing as well as from the clinical side and safety profile side as well.
How much time would you need to start producing a large number of doses?
So looking at the epidemiology of what we're seeing with monkeypox, what we anticipate is the need that is such that we've seen about sort of 4,000 cases pop up in non-endemic countries between sort of May and June, and we're now sitting at about 18,000, I think, across 75 countries. So you can see the numbers are much, much smaller than what we were experiencing in terms of need for COVID-19 vaccines. The upshot of all of this, Stephen, is that whatever requirement is thrown at Aspen, we believe we have the capacity to meet.
Thank you very much indeed. Dr Lisa Bonadona is the Aspen Group Executive for Biologicals and Commercial. Do appreciate the time. The suspects in the Sweetwaters Tavern shooting have abandoned